people enjoying a good time outdoors, working in their gardens, taking their kids to the park, or hiking in the woods can unwittingly come into contact with a serious health threat, Lyme disease, transmitted by a tiny deer tick. Because the ticks are so small, many people never see them on their children or their pets. They may even be unaware that they have been bitten until the symptoms appear. Clearly, Lyme disease needs to be taken seriously, especially when taking into account the love that Staten Islanders have for their parks. Lyme disease is an infection caused by a bacterium which is carried by deer ticks. An infected tick can transmit the bacterium to the humans and animals it bites. Untreated, the bacterium travels through the bloodstream and can cause a number of symptoms, some of which are severe. When hearing the stories of people who have struggled with Lyme disease, it becomes evident just how wide-ranging the symptoms of this disease can be.
Real bad headaches impacted my hearing, my sense of taste, my sense of smell, vision, sensations, about your face area, falling asleep in these types of patterns, eyebrows to the tip of the nose, tip of my tongue. My speech was affected, my range of motion, flexibility. I would have muscle spasms, twitching, pain in the joints, different other parts of the body.
Achy, tired feeling, arthritic pain.
I had fatigue, I had muscle aches, my nerves in my arms felt like there were bugs crawling. I was getting severe migraines, 2 minutes of no vision. My bones were killing me, I couldn't get up from bed.
I was forgetting things, numbness in my right hand slightly, then the joints are cracking and making noise. Then I have the neck problems, the neck stiffness. Then I have a cloudy head. In the morning I was dizzy. I couldn't sleep very well and not rested, and the mood changed. Very, very bad tempers you get.
I was very miserable, arrogant, agitated, angry, grumpy, if you name it. I was all of the above, sleeping 2 to 3 hours a night. Such excruciating pain in my elbow and my middle back. Arthritic aches and pains in my joints, basically mostly in my knees. I had terrible memory loss, short-term memory loss.
Very high fever, the chills, then I got like a cold sweat, very, very bad sharp pains in my head, muscle soreness, achiness, headaches, dizzy, nauseous, body aches. I feel like I have a flu every day. Forgetful, and that's me. I'm forgetting like crazy. I mean, I'm dead every day. I'm not me. I have a big house. I do my own cleaning, my own cooking. I love company, but you know what? I feel like I'm dragging my body. My poor husband, I feel sorry for him.
I never saw the tick that bit me. I never saw a bullseye rash.
I had seen no tick at all.
No, I never saw the tick.
I didn't get the tick. I didn't know. I didn't see it.
To my opinion, prevention is better than treatment.
It's a brutal disease, and I suggest if you go in the woods, spray yourself. So I take extra precaution of where I go when I go hiking. I stay on the main trails. I don't trek off into the thick brush, because that's where they are.
I absolutely do not go into areas that are heavily wooded, dense underbrush, the whole 9 yards, unless I have to. And if I do, I'm very conscious about how I look at, check myself for the clothing, even after I take my clothes off, whether I take a shower or whatever the case may be.
We have done a good job protecting the natural areas in our borough, meriting our title as the Borough of Parks. In fact, our parks and Bluebell areas make up over 25% of our landmass, and that number will be expanding to an astounding 32% as the Fresh Hills property is converted into a park twice the size of Central Park. Parks are common places that people come into contact with deer ticks, particularly in shaded woods and areas with high grass. However, the ticks are also found in flower beds, backyards, and lawns. And humans are not the only ones that we need to protect from tick bites.
Pets are vulnerable. They're more likely to get into places where ticks are. They go sniffing around holes and sniffing around tall grass. It's just a thing that dogs do. So it's good to check your pet for ticks when you come in. You can just pet them. You can feel under their face or in their paws, because that's a place ticks like to go. You could use a preventative. There's several good ones on the market. Some of the symptoms we see with animals that present with Lyme disease are a shifting leg lameness. It's not uncommon for an animal to come in here and the owner said, he's kind of lame, but I'm not sure which leg he's lame on. Those animals we almost always test for Lyme disease, because one day one arm will hurt them, the other day a leg will hurt them, and the owner's never quite sure which leg they're limping on.
It remains an open question as to whether Lyme disease is present on Staten Island, but we definitely have deer, so a few simple precautions are certainly worth the effort to prevent tick bites. Wear shoes and light-colored clothing so you have a better chance to see ticks should they get on you. Tuck your pants legs into your socks and your shirt into your pants. Stay on paths and don't let children or pets wander. Scan clothes and any exposed skin frequently for ticks. If you want to wear insect repellent, make sure it contains DEET. Avoid sitting directly on the ground or against stone walls, which are habitats for ticks. Keep long hair tied back, especially when gardening. Do a final full-body tick check at the end of the day. Also check children and pets. Even if you stay away from wooded areas, a watchful eye should be kept for ticks that are brought into the house on pets. Ticks will attach anywhere on the body, but prefer creases such as the back of the knee, armpit, groin, and nape of the neck.
It's very important to be tested as soon as the symptoms occur, so it could stop any kind of further damage that Lyme's disease can cause.
If you catch it, you're lucky, because they could treat you right away and you could be cured. In my case, I had it 2 years and didn't know about it.
If it becomes chronic, you are really, really in bad shape, like me.
For Staten Islanders, the important message is to be aware and informed. If a tick bites you, remove it and see your doctor immediately. We must be able to enjoy the outdoors without the threat of a debilitating illness at our feet.
Good evening, ladies and gentlemen. My name is Ed Burke, and I'm Executive Assistant to Borough President Molinaro. Welcome. Well, like the patients we interviewed for that videotape, in my case, I was diagnosed with Lyme in 2004. I never saw the tick. I didn't see a bullseye rash. I didn't know I was bitten. I just got the symptoms, and this led me on a path to tonight, because Lyme disease is a serious problem. It's a serious thing to face, not only from the pain and the fatigue that you feel, but for me, it shuts me out from things I used to love to do in the great outdoors, chasing after a ball or hiking through the woods. And I think more and more people are going to become reticent about doing that unless we come to grips with Lyme disease. I have lots of questions about now, as someone who has Lyme disease, how do I cope with it? Can I be reinfected? And I think a forum like this lets us all have that opportunity to ask questions of the experts. And I want to thank our experts for being here tonight, and we're going to have an excellent presentation. And I am here to introduce the host of this forum. Many of you may know Borough President Molinaro as someone who brought back the boardwalk and somebody who fights for us and our quality of life in so many ways, but what you might not know is he has a special place in his heart for people who are sick and ailing, and he's very active with hospitals and with, he brought the first AIDS daycare center here at a time when there was not much support for that. So I think the day I went to him and said, could we have a Lyme disease forum, I didn't finish the sentence before he said yes. He wants to help us. So please give a warm welcome to our Borough President, Jim Molinaro.
Thank you, Eddie. I get the accolades, but they do the work. Trust me. Tonight's meeting is not for the purpose of scaring you to keep you out of the woods and off our parks and out of your backyard, but to give you a better understanding that the ticks are around us, and they could be very dangerous to us if they're not detected very early. And going back a number of years ago, I had a very good friend of mine on Staten Island. His name was Jimmy Simpson. And For years, they couldn't find out what was wrong with him. They finally did find out that he did have the Lyme disease, and at that time, and he had to actually live home with an intravenous in his arm for about 6 months. He had to go to bed with it, he had to sleep with it, he had to eat with it, he had to go to work with it. And he was in very, very bad shape. And that was my first occasion of knowing someone that had Lyme disease. And I think tonight what you're going to see is ways to protect yourselves. And if you have symptoms that you may feel that maybe you were in contact with a tick, I believe a simple blood test, I don't know if it's a simple blood test, but a blood test can detect whether you are or not. And not to be alarmed, if you catch it in the early stages, I understand it's very simple to correct it and to cure you, well, at least to put it in remission. So that being said, I want to thank Ed Burke and Dr. Visconti who put this together. Although I said yes, but they were the ones that did the hard work. And also I want to be very complimentary. I never expected this many people here today. Never, never, never. But it's good that the public turned out, and it shows there is a concern. And I really want to thank you for turning out, and I think you will not be disappointed. You will not be disappointed. You will go away learning something that may help you or help one of your children or grandchildren. So once again, thank you, and God bless you.
Okay, we're going to turn the forum over now to Dr. Visconti, who will be moderating.
Thank you, Ed. Thank you, Borough President Molinaro. On behalf of all of the panelists here tonight, we want to thank you for the opportunity to come here and discuss this very important topic. Let's go into our first speech for the night. Sally Slavinsky from the Department of Health is going to talk to us about a topic that I know we're all dying to hear about, and that is Lyme disease in New York City.
I'm with the New York City Department of Health with the Zoonotic and Vector-Borne Disease Unit, and essentially it's our role to monitor vector-borne diseases in New York City, one of which is Lyme disease. And just to give you some perspective, it is thought to be the most common vector-borne disease in the United States. In 2004, they don't have 2005 data yet, so we went with 2004, there was almost 20,000 cases of Lyme disease reported in the United States. So that gives you a national average of about almost 7 cases per 100,000 people. And there's 12 states where they consider Lyme disease to be most common in the United States. And those include the states listed below: Connecticut, Delaware, Maine, Maryland, Massachusetts, Minnesota, New Hampshire, New Jersey, New York, Pennsylvania, Rhode Island, and Wisconsin. So the vast majority of those states are along the North Atlantic. And that's just a map to give you a visual of where these cases are occurring. And so just so you know, how do we define a case of Lyme disease? How does a case get reported to CDC? What criteria does it have to have? The first thing is either they have to have what we call an erythema migrans lesion, or a bullseye rash, or a target lesion. If you're not familiar with that, that's the lesion that can occur after a tick bites, and usually occurs at the bite site. And what happens is the bacteria, which are spirochete bacteria, they tend to migrate underneath the skin out radially. And so this rash gets larger and larger and larger. And you tend to have a red rash in the center with a central clearing, and then another red ring on the outside. It has to be 5 centimeters in diameter or larger to be counted as an EM lesion. So if a patient presents with that, automatically they're considered to have a case of Lyme disease, and treatment is recommended. If they don't have that EM lesion, then if they test positive, serum test usually, and they also have compatible clinical symptoms, then they're also considered a case. And in 2004, New York State reported about 5,100 cases of Lyme disease. 356, actually 357 of those cases were from New York City. There's not a lot of people that report being in New York City when they were likely bitten by a tick. We think that the vast majority of people that do get infected with Lyme disease may be traveling outside of New York City. We have lots of good information on the Health Department website. You can go on to our main page and then click Health Topics A through Z, and you can click on ticks to get a bunch of good information in general. And then you can also get information about the specific diseases. And if you click on Lyme disease, a lot of the data that I just presented will be available on there.
That was very informative. And now I'd like to turn over the floor to a very busy family practice physician, Dr. Richard Lucenti, who I've known for many years. Rich?
Thank you very much, Dr. V. And I think the biggest point for me is that I can't remember how many cases of erythema migrans that I've seen. I really don't see many people who come in and say, what is this rash? But I've diagnosed most of the people based on the symptoms. So I think it's important, if you're not feeling right, you're feeling fatigued, you have joint pain, or these non-specific symptoms that are lasting longer than a cold and they're not going away, that it's probably a good idea to talk to your primary care physician about it, and maybe he should send a test, he or she should send a test for Lyme disease, because it's very common, and it's a lot more common than even a lot of the healthcare professionals know. It's caused by a spirochete. Spirochete is a spiral-shaped bacteria that's called Borrelia burgdorferi. This is the appearance under the microscope. It looks like a corkscrew, and it's a spiral-shaped bacteria that's similar to what causes syphilis. So how do we get this bacteria? The ticks acquire the bacteria by feeding on infected animals, typically deer, then spread the infection to other animals and humans by subsequent feeding. So the tick kind of jumps from person to person or animal to animal and spreads this disease. And it's the bacteria, the spiral-shaped bacteria, that causes the disease, not the actual tick itself. So ticks have 4 life stages. They are the egg, larva, nymph, and adult. You could see this slide just illustrates that they come in many sizes and shapes, and they can be very tiny. So a lot of times people don't know that they were bitten by a tick, and they end up with the symptoms. And that is my part. Thank you.
The second portion of the lecture is going to be given by Dr. Joan Graziano, who is, as all of you know, is a pediatric hematologist who has handled a lot of cases of Lyme and related disorders here on the island. So without further ado.
So the first and foremost thing is Lyme is a clinical diagnosis, and that's important to remember. We do have tests available, and the indirect tests are going to be the ELISA, and you need confirmatory Western blot. These detect the immunological response to the infection. And unfortunately, not everybody, in my opinion, makes a normal immunological response, and therefore the tests don't always detect everybody who might be at risk. There are direct detection tests available now, such as culture and PCR, that might prove that you have infection, but they're expensive. Many insurance companies do not pay for them. Sometimes we can get them approved. And negative tests don't rule out infection, and that's very important to remember. The symptoms of Lyme disease are very variable, and really we need to look at them in 2 phases, the early phase and then the late phase. The early phase can very much mimic a flu. You may have the true erythema migrans rash, as they spoke about earlier. Erythema migrans is a red rash that then clears and has an outer red zone, and thus it gets the bullseye name. And oftentimes people don't remember having it or never did have it to start with. Other symptoms might very much look like a flu-like symptom with chills and fever, headache, sore throat, body aches and pains, swollen glands, nausea and vomiting, and these can all go for early symptoms of Lyme disease. That's your typical EM rash. You can see how it kind of has that bullseye appearance to it. That's another early one. And yet another. Sometimes you might get some desquamation at the area. Other rashes can be petechial in nature, and that can mimic some other illnesses as well. Petechiae are small pinhead to pinpoint red lesions. Anything larger than that would be a bruise. Then we get into some of the late neurological signs that can develop. This is after you've gotten over your flu. Some mild neurological signs such as headache, you may get meningitis or just meningismus actually, cranial nerve palsies, and one of the most common is the facial nerve, which can give you that numbness in here and even drooping. Very rare are cardiovascular signs such as irregular heartbeats and conduction blocks. You have ophthalmological signs such as inflammation in parts of the eye and blindness. Very vague to very specific musculoskeletal signs. You may have a true arthritis in which your joint is swollen, but you might just have joint aches. So anyone who even has these kind of vague symptoms, and especially recurrent symptoms, needs to think about getting tested. The therapeutic aspects of Lyme disease are that there are 4 kinds of antibiotics we use: the penicillins, the tetracyclines, the cephalosporins, and the macrolides. And we don't really have proof of what bacteria, since we don't necessarily have a good test for direct detection of the infection. Obviously, it would make sense that which antibiotic has the best killing, or whether they actually kill the infection at all, is not proven. The best thing we can do is detect early detection and prevention, and try and prevent somebody from going from an acute phase into a chronic Lyme disease, which is harder to treat. There can be permanent damage from persistent infections. And I think Dr. Visconti and I have shed several patients who've had just permanent joint pains that just don't go away, back pain. And those are the more milder permanent damages that can happen.
Well, I think that was an outstanding discussion, as all of the discussions tonight have been. What I'd like to do now is take about 5 or 10 minutes with everybody and take one of Joan's statements. If you aren't improving, you have to keep on looking. In the 25 years that I've been working with chronic fatigue patients, if it's one thing I've learned is you don't stop at just diagnosing one thing. Because as a physician, if you don't keep on looking or keep your mind open, the patient is the one who's going to suffer. So I'm going to be taking this into 3 separate parts, and I'm going to try to discuss with you, first of all, what other infections you can get from ticks. I'm going to go into some of the infections that can look like Lyme. And finally, I'm going to go into some of the different multi-system disorders that include cancer. And if it's the one message, I guess, that I would like everybody to take out of the room tonight, would be to go and get a good physical exam and be sure that something is not being missed. So we'll start off with tick-borne diseases. These are diseases that can be transmitted by ticks. Many of them are here on Staten Island, and I'll point out to you the ones that I have seen and the ones that I think are particular problems. And some of them can present with rashes that don't look like the Lyme rash, but if you're on the lookout for it, you can actually save yourself a lot of disability and even hospitalization. So with that as a little bit of an introduction, let me just point out that, if I can, Babesia and Ehrlichia, which have really been broken down into 2 separate categories now, Anaplasma and Ehrlichia, are really carried by the same ticks that give you Lyme. And of the 3 ticks that give you Lyme, and I'm going to be showing you a picture of these, the Lone Star tick really borders right on Staten Island. It comes right up through northern Jersey, so that along with Lyme, you may have what we call co-infections that whose symptoms are a little bit different than Lyme, and in the case of Ehrlichia, may even require an acute hospitalization. And I've done that on many an occasion, not just to a regular room, but to intensive care unit, and very easily treated, which is why I'd like to point out to everybody, recognition and prevention is the way to grab hold of these things before they really make you ill. The other one that I would like to highlight is a misnomer called Rocky Mountain Spotted Fever. And why it's a misnomer is that most of the cases of this occur in Delaware, and some of them have been reported out of Central Park. I've had cases in the Brooklyn area, and yes, every summer I'm sending reports to Sally's group about a Rocky Mountain spotted that is referred to me through one of the very fine physicians on the island for treatment. And the vector, or the tick of Rocky Mountain spotted fever, is here on the island. It's the common dog tick, and I'm going to show you a picture of it. The other tick-borne diseases, Q fever, I've seen a few cases of this. This can cause a heart infection. There is no rash particularly with Q fever, but I'd like to tell you about tularemia. This is a condition that used to be only by exposure to small animals like rabbits. It can present with a number of different presentations that can go all the way to a very severe pneumonia. A patient can be deathly ill with this, and it has been experimented as a biologic agent in addition. Now, what is emerging now with tularemia is that that is now appearing in certain of the tick populations, and some of the real pioneers in the field have been testing people for the presence of exposure to this germ, and people are coming up positive. But the reassuring thing is that they're not getting particularly ill with it. And all of these things are treatable. So let's go a little bit more in detail over the Ehrlichia and the Rocky Mountain spotted, because those are the ones that would make one more immediately ill. Lyme will give you a flu, but these two could put you in the hospital with high fever and can affect many of the different organs like the heart, the brain, and again, very easily treated. And here is our Staten Island friend. For all of you lovely people who bring me your ticks to the office and I send them to the lab, 90% of you have brought me dog ticks. And again, I'm not minimizing the fact that we don't have a majority of Lyme ticks, because as I've said, these conditions are more immediately potentially deadly to the patient. And this would be a picture of what a patient with Rocky Mountain spotted fever would look like. And unfortunately, I've seen this all too often. But again, if you do get a rash like this, please let your doctor know immediately. It may not be mosquito bites. You may have been bitten by a tick, and it may be very easy for your doctor to treat you and cure you before it gets to the point of compromising your circulation. So far, what have we found out? We found out that ticks can give you a variety of other infections, and we have them here on Staten Island. What this slide will tell you is that there are rashes that are not tick-related, but are potentially treatable. Let's talk a little bit about strep. Strep seems to be making a comeback, at least in my practice this summer, and it can give you a rash that can resemble the rash of Ehrlichia, can look like scarlatina. And again, the treatment here would be a little bit different, then be a different antibiotic. And finally, every summer there appears a virus that usually works its way, one of what we call enteroviruses. They come every July or August, and they affect our children, hand, foot, and mouth. Anybody's ever heard of Coxsackie with your children? Okay. Well, we're heading into Coxsackie season. So this kind of rounds out the differential of rashes. They're not all due to Lyme or rickettsia. They can have a viral cause, or they can have a strep as a cause. So the other infections that are involved in somebody who comes to my office and say has sore joints, doesn't feel good, has chronic fatigue, can be that they were exposed to one of these rickettsia that we talked about, or it could be that they may have one of these other infections. And I'm just going to very briefly touch upon these, because some of these, again, prevention, an ounce of prevention will be a pound of cure. I've had about a half a dozen cases over the last year of a parasitic infection that we quite simply get by buying pork and not cooking it. I've had cases where patients have gotten this from sausage that has been incompletely cooked. I've had them come down with this from restaurant food that was not properly cooked. So the take-home message here is that there's something out there that looks like Lyme, that gives you sore muscles, that has nothing to do with ticks, but it has to do with what you're eating. So I would advise all of you, enjoy your pork, enjoy your restaurant food, but be sure that it's thoroughly cooked, because this can mimic the symptoms of Lyme, and if it isn't treated, the muscles can be destroyed. Another one that has given me a little bit of headache over the past year, although everybody's done well, is this one. We didn't see this one for years, and all of a sudden I've got a half dozen cases in my practice. Brucella has nothing to do with the same mechanism by which you get Lyme. Brucella is a disease that we get that can give us meningitis and give us pneumonia, joint infections, and we get this by exposure to small animals, such as rabbits, goats, and this has been primarily the way my half dozen cases have come down with it. And I've had whole families with it and admissions into the hospital. One individual I had to treat for a heart infection with it. The early stages of HIV can present as a flu. Hepatitis can present as a bad arthritis. And since hepatitis, if it is missed, and particularly certain forms of it, particularly hepatitis C, can lead to a preventable, curable cancer if it's picked up, it's important that your doctor check you out for this. Finally, we have a germ called Bartonella, which in 98% of cases comes from a little person who we love right in our home, our dog and our cat, who can look absolutely perfect, can be frisky, and can have a density of a billion of these germs in their blood. And we can get this by getting licked by our pet. It doesn't have to be a scratch. It can be a dog or a cat. Bartonella has also appeared in some of the tick population, so that the Lone Star tick, the Jersey one that I mentioned, is one that can give, that carries this infection as well. But in the vast majority of cases, this one is homegrown. It's right in our home. Chlamydia, I will touch upon very briefly. This, how I got into this infection was people thought they had Lyme in January, the coldest winter. Winters that we had in the 80s. They had joint aches, they had malaise, but the difference here is their illness started out with a cough. And as I worked them up, I found that they were infected with this germ. This has nothing to do with sexual chlamydia. This is the kind we cough on each other. Now, why are we so worried about this one? Well, we're worried about picking this one up and properly treating it because some of the newer data shows that chlamydia likes to make plaque in various parts of our heart, parts of our body, including the heart. There's been a lot of cardiac literature about plaque around the heart that chlamydia contributes to, and there's even a large study being done treating it to prevent Alzheimer's disease. So the verdict is out on those, whether the treatment for this germ is going to prevent those conditions. There's no absolute answer to it right now. But again, this is another infection that can give you symptoms that look a lot like Lyme. So I'm going to close with a differential diagnosis. And the differential diagnosis of the advanced stages of Lyme, and as all of you know, because I've treated most of you in the last 20 years, I know that most of you have Lyme, but this portion of my talk is dedicated to those of you who are not able to be here tonight. And I have seen time and time again people who will come to me by referral with joint aches, malaise, a little weight loss. You do a good physical exam on them, a little bit of investigation, and unfortunately, what you find is they've been walking around with this chronic fatigue for a few years, and during that time, their fatigue was due to a cancer. And the most notorious cancers that I've had that have been very silent have been the stomach cancers. I have some in the bowel as well. So again, the take-home message is that if you're feeling tired, get a good checkup from your doctor, including a good cancer screen. So much of this is preventable and curable at this point. I think some of the others, Dr. Lucenti has already mentioned in his talk, So I'm going to close just by telling you that late stages of Lyme present with very nonspecific symptoms, and that part of the workup includes a very thorough investigation for Lyme. It's a bad disease that really puts a lot of people down, a lot of lost productivity. It's the reason why we're here tonight. That's one side of the coin. But the other side of the coin is that there are other infections and other non-infectious conditions that can mimic the same symptom. So with that, I would like to call a very good friend of mine, Dr. Brian Fallon, who's been a pioneer in the field of Lyme, a true pioneer. For the last 20 years, we've been working on cases with each other. And he's from Columbia Presbyterian Medical Center, and he has done the premier work on neuropsychiatric Lyme.
Thank you very much. Thank you for inviting me. This is an important event out here in Staten Island. Why I'm here today really is to not say that most psychotic symptoms are due to Lyme disease, and not to say that most irritability and mood disorders are due to Lyme disease, but to say sometimes when you have an atypical presentation of a neuropsychiatric disorder, Lyme disease should be in the differential, just like endocrine problems, just like other infections. So I guess that's the main point I want to convey. And the second main point is, if you do have Lyme disease and if you do have psychiatric symptoms, don't do what most people do. What most people do is they say, I'm not going to a psychiatrist because that will mean it's all in my head. And if you don't seek adjunctive help, you're going to deprive yourself of getting better more quickly. Okay, so just a quick review of neurologic Lyme disease, meningitis, encephalitis, which is characterized usually by confusion, cranial neuritis. You might have sensory symptoms, you might have motor symptoms, you might have confusion, you might have what looks like an MS illness, and you can have neuropsychiatric symptoms. Commonly, you'll look like you have chronic fatigue syndrome. You might have a lot of sensory hyperarousal, so light may bother your eyes so that you can't go outside in daylight. You may have to pull the shades in your house. Sound may bother your ears. You may have cognitive problems where you're thinking slowly. You just can't follow conversations like you used to. You can't remember what was just said. You say the wrong word. Instead of saying fork, you say bork, or instead of saying radiator, you say microwave. Words just aren't coming out properly. And you can have tingling, numbness, shooting or stabbing pains, and lots of mood problems, irritability, depression. It looks like you have a personality change. Your frustration tolerance is diminished. Okay, the blood tests for Lyme disease, at least in the acute inflammatory phase of Lyme disease, aren't bad. They're actually pretty sensitive. But once you get to later stage Lyme disease, after it's been in your system for a while or after you've been treated, the Lyme ELISA and the Western blot aren't that sensitive. So it really is a clinical diagnosis, which is what you've heard earlier, and it's supported by lab tests. But you can't exclude Lyme disease necessarily with a negative lab test. But there are lots of causes of why people may have persistent symptoms, and it could be that they have persistent Lyme infection, or it could be that they have an autoimmune type response. It could be that they have another co-infection carried by the tick. It could be that they have damage from the prior infection. It could be they got bitten again and they don't remember it. Or it could be that you have been misdiagnosed, and that happens as well. Now, if you look at an MRI scan, which looks at the structure of the brain, you may well see these hyperintense areas, these white spots up in the brain. Those are called UBOs. If you do what's called a functional type of scan, which looks at the functioning of the brain, all these yellow spots are areas of decreased blood flow in the Lyme patients. The red and yellow spots are all hot spots of decreased blood flow. All these are decreased areas, these gray spots here. So as you can see, there are many areas of the brain that are affected by Lyme disease when you get it neurologically. And we did a study to see is a repeated course of intravenous antibiotic therapy helpful. This was a very expensive study, $5 million from the NIH. We finished it recently, and what we found was that, yes, indeed, a 10-week course of IV antibiotics was more effective than IV placebo in improving in improving, this is the drug-treated group, in improving physical functioning compared to the placebo-treated group. And we also saw improvement in pain, fatigue, and cognition. So again, don't avoid psychiatric treatments. Psychiatric meds are amazing. They can actually increase dendritic connections. Antidepressants will increase not only your brain neural connections. It's extraordinary that they do that, but they do. And we all want a future without Lyme disease. I think it is possible. The ticks, however, are extraordinarily prevalent, and you'll be hearing more about ticks next. Thanks.
Thank you, Brian. That was outstanding as usual. Our next speaker is Dr. Richard Falco, who is a medical entomologist at Fordham University. Rich?
Thank you. First, I'd like to thank the Borough President for inviting me here today. I also want to compliment both Borough President Molinaro and Staten Island officials, because I've been doing this for over 20 years, this kind of research, and the first reaction by counties is usually to ignore the problem until it's a real problem. And I give them credit for being proactive. This is the adult female deer tick here. You can see the orange abdomen, the dark scutum. These adult ticks will get on a host, feed for up to a week. The primary host for the adult deer tick, as many of you know, are deer. Generally, you don't have high populations of deer ticks in areas that you don't have deer. If you don't have deer, certainly they can feed on other medium-sized mammals like raccoons and squirrels. But to maintain those high populations, you really need deer to be present. Deer get a bum rap, though, in some ways, because deer are not very good reservoirs for the Lyme disease agent. For that, the role falls primarily to white-footed mouse and chipmunks. But the deer, again, you need deer to have those populations. So they're not responsible for passing on the spirochete, but they are responsible for hosting the adult deer ticks. Where are these ticks generally found? In the suburban habitat? Well, if you break the suburban habitat down to four categories: lawn, ornamental plants, ecotone, which is the edge between the lawn and the woods, you can see that the most ticks are found in the woods. That makes sense. It's a woodland tick. The lawns, not too many. But you got to realize that these lawns represent a very high-risk area, because most people spend more time here than here. If you have 10 ticks here and 1 tick here, but spend 10 times as much time on the lawn, your risk is the same. So in the suburban habitat, we really have to be concerned with all of these four categories. And again, particularly here and here, lawns and the ornamentals, because that's where people spend most of their time. This is a slide taken many years ago by Dr. Dennis White of the New York State Health Department, and I like to use this slide because it really, again, it shows the different stages of the deer tick here: larvae, nymph, male, female, and it shows the size in relation to a poppy seed and a sesame seed. This here is, again, I also like this slide because it shows the deer ticks in relation to the dog ticks right here. And actually, in the little movie we saw at the beginning, all of those ticks in that movie were dog ticks. You notice that those white markings on the back. Again, dog ticks are very, very common in this area. So again, it's helpful just to kind of get an idea for what these ticks look like. Particularly, you want to get a search image for this nymph and this female. How to remove an attached tick? Well, again, take a fine pair of forceps, and I think you heard this earlier. Take a fine pair of forceps, rest the mouth parts as close to the skin as possible, pull out in a steady and firm motion. You don't want to use a lighted match or a cigarette. There's one theory that if you put a heat gradient on the tick, you could encourage the tick to disgorge its gut contents into the host, and if there's spirochetes in there, you may hasten transmission. You don't want to use Vaseline. Don't use anything, just take a fine pair of forceps, and pull the tick out. You may break off those mouth parts. That hyperstome is very long and it's got those teeth. And you may want to treat for a second, possibility of a secondary infection. But the threat for getting Lyme disease is removed once you remove the tick. Length of attachment is very important. We know now that in most cases, even if a tick is infected, it takes about 36 to 48 hours for transmission of the spirochete to occur. That's why when you check yourself for ticks at night and you remove a tick, even if it is infected, you can prevent yourself from getting Lyme disease. There was a paper a few years ago out of Westchester County showing that one dose of antibiotics administered within 72 hours of removing a tick that had been attached for 36 to 48 hours, or for 36 hours, can prevent Lyme disease. So a lot of physicians now are recommending that if you have a tick that's been attached for 36 hours, at least 36 hours, offering the patient the opportunity for, to get that one dose of doxycycline. If you remove a tick, you have any questions, I certainly urge you to see your physician. And that's all I have, and I'll turn it over to Dr. Daniels now.
And so is there risk for Lyme disease in Staten Island? Well, we found tick sampling suggests that risk is relatively low, but the tick population can change a lot in a 5-year period. You've got an abundance of appropriate habitat. There are anecdotal reports of ticks, and in fact, I was speaking earlier to one of the gentleman who works in the parks, and apparently they are finding scapularis in Staten Island at levels that we had never seen before. Still not very high, but something to be concerned about. Do you have deer? Yeah, and it's apparent that you do. And so you do have not only the habitat that's appropriate, but you've got the complement of potential hosts that would be very important for establishing a deer tick population. And that's all I have to tell you as far as that goes. I'll be happy to answer any other questions.
That was terrific. Well, we're going to close off with a few closing remarks from Mr. Tom Forshner, who is the Executive Director of the American Lyme Disease Association. Tom?
Thank you, Dr. Visconti. One minor correction, it's the Lyme Disease Foundation. We've put together a lot of educational information, TV programs. Our website now, lyme.org, gets 6 million hits a month now, and it's growing every month. Some of the problems that we've had, though, over the years is the myth versus fact. Now, you've heard about the history earlier on. A lot of people thought, for the longest time, that Lyme disease, sorry, this bug coming around me, got him. It is not a tick, it's a fly. That Lyme disease, you had to be in Old Lyme, Connecticut to get Lyme disease. Another myth, a majority of the patients get a nice bullseye round red rash. Unfortunately, that's not true. And again, if you look at the brochure that we have out there, the rashes on this brochure come from the SmithKline Beecham vaccine trial where they had over 11,000 patients. And one of the findings that they found was the bullseye rash was actually the minority rash. It was the one they saw the least. So that not everybody gets a bullseye rash. Another myth, patients are Lyme wannabes. They don't know what's the matter with themselves, and they just want to have Lyme because it's the in disease and it's a yuppie disease. And a lot of the patients are thought to be hypochondriacs. Well, some of them may be, but they deserve respect. And I think they also deserve a good evaluation, an objective evaluation. Another myth, Lyme is easy to treat. That's true if you catch it early. There seems to be a 6-week window where if you get treated and diagnosed very early, most people do just fine. Once you go outside that window, that's where most of the patients have a really hard time and the cost starts increasing. Unfortunately, in that study, the other thing we found out was it took, on average, about 7 different doctors 22 months before they finally got diagnosed. So a lot of these people, and this goes back about 8 years now, a lot of these people were going and becoming chronic because nobody ever treated them. The disease had a chance to become disseminated. Another thing, the Lyme blood test is diagnostic. And if you don't test positive, you can't possibly have Lyme. Again, in the SmithKline trials, and again on our website, we have a video that actually talks about this. They found that 1/3 of the patients who they were absolutely sure had Lyme because they were able to culture the bacteria, 1/3 of them didn't test positive on any of the tests. So we know that people are being missed if you just rely on the test. So as one of the physicians said earlier, you have to do a clinical diagnosis. So let's leave a legacy to all our kids and to all Lyme patients, and together we can do this. Thank you.
Now we come to probably the most important part of our presentation, and that is we want to hear from you. Any questions?
Can a person suffering from Lyme transmit the disease to their child while pregnant?
It can be transmitted to the baby, and that's why I've treated a lot of pregnant ladies through the years. As soon as, I know that they are pregnant and that they have active disease, I do treat them. And I've had all good babies out of those outcomes. So the important thing is if you think you have it and it's the beginning of pregnancy, get treated and get followed very closely.
Is there a Lyme disease affecting kidneys and bladder?
Lyme disease can definitely affect bladder function. I've seen that very often. It's part of the neurologic, damage that can occur.
After I've been outside and I come home, I can't immerse myself in my pool of chlorine for 2 hours and kill the ticks. They're that hardy. One of our staff members brought in a tick that was on him, and it's so tiny, looking at it through this plastic bag. It's so difficult to do a tick check, really, with any kind of reliability. So anyway, it's a crazy question, but just in terms of checking for the ticks, there's nothing you can do beyond visual inspection to address that problem?
No, right now that's really all you're left with, and that's why there are so many Lyme disease cases, and that's why, as Tom said, even if you take these precautions, even if you check yourself every night, you're still going to miss ticks. I look at our staff, and our staff knows exactly what to look for. They're trained with the search image, and every year we get a case of Lyme disease, and we know what we're looking for. So unfortunately, that's all we're left with. The pool won't do it.
I would like info on treating a child. If an antibiotic does not work after 6 weeks treatment, what is known about A, the Rife machine, and B, treatment with salt and vitamin C?
Well, those treatments, fall into the realm of possibly alternative treatment. And I think most of the speakers here are traditional. We were educated traditionally through the system so that we're not alternative physicians. It might surprise you to know that I have a number of people who I cannot treat because they're allergic to every antibiotic. And I've had to send them to alternative physicians and chiropractors, and I respect their work because they've worked with these patients who I could not treat and have eventually made them better. So I guess, the answer to it is that if after 6 weeks your child is not better on antibiotic and you're sure that your child took the antibiotic, what it comes down to is what I had mentioned to the other gentleman. Go back to your doctor and be sure you don't have a co-infection from the same tick. You may have had one of those rickettsial infections that I showed, in which case amoxicillin would not be effective. You'd need another medication.
Okay, doctor, she has a second question. What type of adverse side effects does antibiotic treatment have on a child?
Oh, this is really, these questions are all terrific. The primary side effect of any antibiotic is that you can get an allergy to it. As all of you know, antibiotics can give you diarrhea through an overgrowth of a bacteria in the bowel. The most immediate thing, and what I tell everybody, Lyme or no Lyme, any antibiotic that I give out to anybody, at the first sign of diarrhea, call me immediately because the antibiotic has to be stopped.
The insurance company thing. My kept coming up negative. Finally, the Western blot have all 12 bands. But they wouldn't give me the Western blot unless the other test came up positive.
Exactly.
So for 2 years I don't get treated and I become a chronic Lyme's patient.
I'm glad somebody brought up the magic word insurance companies because I don't think that's been discussed at all. And the problem is that a lot of times the tests are negative, and sometimes there are better tests that we can send, PCR and labs that are concentrating on looking for these types of illnesses, and they're not covered by insurance. And also, therapy is not always covered by insurance. There was a slide that was shown that IV therapy is superior to oral therapy, and I know Dr. V deals with it as well as myself. You can't get IV covered for a patient because they're not recognizing that chronic Lyme needs to be treated with IV antibiotics for an extended period of time, and they won't pay for the PICC line, and they won't pay for the IV and antibiotics. They won't pay for PET scans if that's needed to look for neuropsychiatric Lyme. So it's an uphill battle with the insurance companies, and a lot of times, Dr. V can attest to this, is that the patients are paying out of pocket for their testing, and I think that's something that should be looked at by legislation or by people that can lobby to these insurance companies that diagnosis of disease is being hampered by insurance companies, and I think that's really a major issue in both diagnosis and treatment of Lyme disease.
I've had Lyme disease since 1984, and in that time I've run 2 New York marathons and completed them in the recent 90s. And I'm an active professor of computer science here at the university, and I've learned quite a number of new computer science topics and languages having Lyme disease. The burden of not being able to think clearly and finding oneself confused and forgetful is really severe sometimes, but the treatment that I was given helped me to overcome that. I think that everybody who has Lyme disease with correct treatment and pursuing anything that seems to be wrong with you, you can live a healthy and productive life.
Thank you for your comments.
The best advice I can give to people is that if you're not feeling well, whether you have fatigue or whatever symptom it is, if you're not feeling well and your doctor's not listening to you, then you may have to go find another doctor. Because nobody knows their body better than themselves. So the advice I have is that if you're not feeling well, just keep pursuing it. Don't give up. Keep seeing a doctor, and eventually you'll find what's wrong with you.
What we're going to do is say thank you very much to our panelists, Dr. Visconti et al. And thank you all for coming.